Welcome to Hero's Journey Physio Fitness. Our mission is to empower, inspire, and mentor people to reclaim their health and become self-reliant in their fitness. I'm your host, Dr. Cameron Hogue. Join with me as my co-host, Annabelle Rios.
All right, guys, we're going live in 3, 2, 1.
Hey, everybody. Welcome to the podcast. Like we always say at the beginning, like and subscribe, feed the algorithm, share the podcast, give it a rating, give us some love. And if you're not on social media, Annabelle, where can they find us?
Everywhere.
We're on everything.
We are.
Twitter needs some love, and YouTube needs some love. So go check those places out. But we're really excited today. We have another guest on our podcast. And again, as Annabelle said last time, you kind of get to see what we look like because we've been incognito, just audio. But today we have Dr. Matt Rutledge. I'm going to give a little kind of background about him, and then we'll get into some really good conversation here. So Dr. Rutledge, he graduated from Florida Gulf Coast University. That's where he received his doctorate of physical therapy. That was in 2017. After that, he started working as an orthopedic staff therapist in the Chattanooga area. And the following year, he went through an orthopedic residency, which is about a year-long residency where you can sit for a board exam. And after that, he sat for his board exam and obtained his OCS, which is an orthopedic clinical specialist. A year after that, he became a clinic director at a outpatient practice. And then in 2022, he left and partnered with Evo Performance Therapy, which is a out-of-network cash-based practice, which we're going to get into today. And he opened an office in Chattanooga. So, Matt, thanks for joining us.
Yeah, thanks for coming.
Thanks for having me, guys. Really excited for this.
So let's start with, I know we gave you a little background. Is there anything from the background that we didn't hit or anything?
No, that's pretty good. Pretty good intro.
Yeah, let's talk about the Murph real quick. How was your Murph challenge?
Oh, Murph. Luckily, it wasn't 100 degrees outside. I think it would have been way worse with that. But
did you wear a vest?
I did. Finished in a respectable 56 minutes.
Hey.
There's some guys that definitely fly through that workout, but
I don't understand.
We're okay with it.
Yeah, I don't. We did this morning. Annabelle was literally dry heaving
the whole time.
Yeah.
I was doing push-ups like.
I thought I prepared myself a little better for it this year. We did some Murph prep kind of weeks leading up, and no, didn't help.
Nothing prepares.
No, it's the push-ups. Push-ups in the second mile. That's what gets you.
Dude.
That second mile is brutal.
Yeah, it hits different. That's for sure.
After you've done 300 squats, your legs are just little jelly beans as you get on your getaway sticks.
Yep.
Matt, give us so I know you were in an insurance-based outpatient practice for quite a while, and then you left and started the Evo Performance. Give us a little background on your journey to this cash-based type of model.
Yeah, so I spent, almost 6 years as I came out of school, just working in the traditional insurance-based kind of corporate type office that you would kind of generally see if you went to see your doctor and they said, go to PT.
Sure.
What that kind of gave me, I'm very grateful for it, gave me a lot of exposure, saw a lot of different types of patients, age ranges, conditions, acute, chronic, surgical, all, everything you could think of seeing. Saw a lot of that. Really good experience being able to go through a residency, kind of fine tuning all of those kind of clinical skills that just a little bit of a step above what we get in our coursework throughout our programs to get our degrees. But really what it kind of hit is after I took over as a clinic director, and you kind of start seeing a little bit more of what the financial side of things look like, and what really kind of got to me was just the amount of kind of volume that they push on us. Healthcare, we all get into it because we want to help people. At least most of us. That's kind of our driving passion. And
For sure.
It gets
for
a little
sure.
frustrating when you start having to kind of more appease the bottom line of the business that doesn't really directly benefit you, doesn't really directly benefit the patient. It really helps the higher ups, which, you know, you don't really notice that until you get to where you can start seeing spreadsheets with profits and losses, and this is what, you know, things are bringing in and all that stuff. So,
Yeah.
you know, I hate to use the word burnout because I think
Well,
it's kind of overused in our general generation, I guess.
Yeah.
But really, it was more of I was losing motivation to be as skilled as my patients deserved. Kind of going through the motions, just showing up, clock in, clock out, you know, not really pushing myself to be as good of a clinician as I knew I could be. And the only people that really hurts is our patients. So for me, that was kind of the step and eye-opening experience to say, like, maybe I need to do something different.
Did you almost feel like all that training that you did with the residency and different Con Ed courses was almost, I don't want to say going to waste, but it felt like maybe you couldn't really hit the pedal and go as fast as you could. It was almost like you just, like you said, going through the motions and not really being able to implement a lot of that stuff. Is that what I'm hearing?
Yeah. And, you know, it's always fun when you take a Con Ed course. You come back the next week and it's like, I've got all these cool new things I want to try. And I've got 4 or 5 people in my mind that this is going to be great for them. And then something happens, you know, they get paired up. You know, a lot of the issues that I had was having to see multiple patients at the same time. And so they just get, you know, they get paired up with somebody who's not optimal to spend this much time doing it, you know, a new manual technique on them, or
someone who's a fall risk.
Yeah. And you're like, oh man, I just learned so much stuff that this person could really benefit from, but I just physically don't have the capacity to implement it. So yeah, that's definitely a big component of it. But you know, the other side is just, like I kind of touched on, is just having to see 2-3 people at a time.
Yeah.
It really wears on you.
I think that's probably challenging because, like you said, you get into this because you want to help individuals, treat them, help them improve, and get better. But it's a business, just like anywhere else. And I think you, in healthcare, it's broken. The system's broken overall. But yeah, they're definitely overworked.
Yeah. Broken is a great way to describe kind of the U.S. healthcare system.
Yeah.
It's dictated by people that don't have the medical training. And that's not just physical therapy. I mean, you can look at anything, surgeons, you know, specialists. Think of, you know, having to get all these hoops to jump through just to get an MRI for suspected cancer. Things like that, you know.
We're going to be down, I believe the statistic is 40% of physicians in the next couple of years. Like, the burnout rate is real amongst almost all healthcare professions, especially physical therapy. But and I know physicians are being kind of forced, unless they have their own practice, to see 40 patients a day, which is ungodly. It's like,
and a lot of them are leaving kind of the general practitioner, being the primary care doctors, and they're going to specialists because, I mean, they can make more money that way, but they're also kind of in control of who they see, and that's just hurting the general population, because we need those good, skilled general practitioners that you know, we see for our annual physicals, or when we get the flu and all that stuff. Decreasing access is only hurting patients, which is frustrating.
Like you're saying, that you want to give them good service and actually treat them and all these things that you're learning, but you can't. So.
And that was the real motivation to go kind of the out of network or cash based side. Is we now kind of take control back away from the insurance companies, and it's right back in our hands. We control, you know, who we see, when we see them, how often we see them, what we do with them, and it doesn't always have to be, you know, strictly directed by, this is what my plan says I can do. Somebody that's sitting at a computer that's checking boxes says you can see them for 6 visits.
How could we cut cost?
Exactly.
Let's take this away.
So that was my kind of biggest motivation, is just, I was either going to leave the field altogether or had to do something different. And I didn't, you know, it's hard to go to school for that long to just abandon
Leave
it. Try to be a real estate agent or, you know, something like that. But
move back to the Florida coast.
Trying to see just a different side of it and kind of take control back, which it's been so fun so far. Definitely a different level of stress and uncertainty and, all that side of it, but it's better than the burnout side of the stress.
Absolutely. For those maybe who are unaware of what, like I know I said out of network, I said cash based so far to kind of describe your partnership with Evo. What does that even mean for people who don't understand the difference between cash based and insurance? What's kind of your saying, kind of what do you usually educate people on when they ask?
Yeah, so there are two terms that really only dictate basically the payment method. In terms of, still a physical therapist, still treating mostly orthopedic conditions, that doesn't change whether you're going to in network or out of network provider. Really what the difference is how things are paid for, essentially. So out of network and cash based, they kind of get entangled. They're technically two separate entities.
Okay.
Somebody could be solely a cash based therapist. Somebody could be a solely out of network therapist. So, or you can kind of have the hybrid. So cash based would be, you don't deal with insurance at all. You take cash, credit cards, that stuff too. Mm-hmm. But you're paid for your service by the person. Nothing's run through any kind of insurance. Whereas out of network technically is still being run through your insurance policy. If you've never looked at what your insurance policy looks like, if you go to your benefits, you're going to have your in-network benefits and your out-of-network benefits. So if you're going to see somebody as an out-of-network provider, you would technically be having the opportunity to send those claims to their insurance company through their out-of-network side. Where that gets kind of gray is a lot of kind of therapists that are working in the same model. We charge a cash rate, we take the cash, but then give the patient the opportunity to submit those claims to their insurance company as their out-of-network benefits. So some policies are great and you'll get a decent chunk of money back from your insurance company. Most are not, which is a whole other topic we'll get into here, I think, shortly. But that's kind of the difference between the out-of-network and the true cash-based. But that level of care can be much different than a true in-network provider. So an in-network provider is somebody who is contracted with your insurance company. You are going to see them, services are provided, whatever it is, and then those claims or that billing is sent to your insurance company first. They will do with it what they want. They will pay for all of it, pay for none of it, pay for a portion of it. And then the remaining balance that they don't cover is then sent back, and it's the patient's responsibility. So that the biggest difference is just who's in theory paying for it.
Yeah. So like I'm working a, I guess, model that is we accept insurance, in-network insurance. And the insurance company will pay, like you're saying, a certain amount, and then the patient is responsible for either their copay or co-insurance, where they pay us up front, whatever it is, 20, 30, 35%, whatever their policy is. And then sometimes you're right. Sometimes it actually, the insurance goes, I know we'd said we'd cover this much, but you still get a bill because we don't want to cover that for whatever reason. And they might be left with whatever chunk of change to keep paying.
And it generally changes every year too.
With insurance. A while back, I helped out with some claims, and there is like a list of clauses to eliminate a reason for people to get coverage. I was like, well, they're not. There's like a laundry list that you go through to exclude people.
Yeah, they're trying not to pay. That's we pay all these monthly premiums to them, and their goal is to just not cover things. Is really what it comes down to. And I mean, again, it's a business; they got to make money, but not that much.
Would you say you're able to give more of a personal touch, being more cash based and out of network? You're able to connect more with the patient instead of just trying to get them in and out the door?
Yeah, 100%. It's very very different in terms of everything I do is not because I'm allowed to do it by what their insurance policy says. It's truly what I think, and then in collaboration with the patient, what is best for them in that time. And that can be anything from the actual treatments we're doing, manual therapy, dry needling, exercise prescriptions, things like that. Or it can be how frequently I see them, how long I see them for, how long each session is. Are they even injured? I see quite a few people that, it's more of a performance enhancing or preventative kind of approach, where it's not even that they're truly limited outside of maybe they can't do a certain movement of their exercise,
which
daily life, they're fine.
Which insurance might deny if they come to an insurance-based model because they're not seeing pain or dysfunction anywhere. And even though this is more of like what you're saying, preventative, they might say, well, we're not going to cover that because, or we're only going to cover 5 visits because technically you're not really injured or whatever.
Yeah. And they are really looking at, can you perform your daily activities? Can you get in and out of a chair? Can you go to the bathroom? Can you take care of yourself? Can you make your own food? Drive? Yeah. Great. You're healthy. You don't need to be seeing anybody for that. Whereas, a lot of people, and I know this is kind of the biggest reason that you guys started this whole thing, is to promote, a much more healthier lifestyle beyond living our daily life. Trying to, incorporate all of those different components of health. And it's hard when you're feeling stuck and you want to reach out for help, and then somebody else just, yanks the rug out from underneath your feet and
says no.
Yeah.
Like, you don't need it.
Yeah, exactly.
So what do you think most people don't know about cash-based? I know you've touched on it some, but there's probably, maybe some people have heard about it, but there's maybe some misconceptions. What do some people don't know?
I would say, well, one, not everybody knows that it exists, in all honesty.
True.
But a lot of, and this is just kind of things that I've heard from, kind of the marketing efforts I've done, and just reaching out to people and having these conversations with them about why the model that we chose to use and why we don't take insurance. But it's often thought of as just, it's an expensive thing that's only for people with money, people that are wealthy. It's kind of like glorified personal training. You're paying for the one-on-one stuff, but it's not for the everyday human. Often, especially when we look at like post-surgical things, like, oh, my doctors wants me to go to PT, but I need to go, to the hospital or to whatever practice they want me to go to. That's another common one. Where in reality, it looks like it's expensive, but it's really that's a false perception. Oftentimes, the per visit rate may be a little bit more, but generally, because of the way that we're able to see people, directly one-on-one, again, have that freedom of doing what's truly best for them, not just what we're allowed to do, oftentimes comes with less visits or less frequency of visits. So it really kind of comes into, what fits into their schedule too. Oftentimes, I know you've probably run into this, is you want to see somebody 2 to 3 times a week because it kind of helps the insurance model. Frequency kind of drives that a little bit more, but they're a mom of 4 kids that have soccer and baseball going on at the same time, work a full-time job,
need a sitter, all that stuff.
Yeah, I can maybe squeeze in Friday morning, that type of thing. That the way that we kind of run things now is we can do once a week, and I kind of encourage that because it also promotes a lot more independence with them managing kind of what's going on. But then it turns into, a lot more flexibility, and both for me and them. I'm not in the office 9 to 5 type of thing. So it's fine to say, let's do 6:30 a.m. before the kids even wake up. Your husband manages the morning and you're home by 7:38. Boom, done with the rest of the day. Or let's do a Saturday. And it's one thing to say, yeah, I got to work on Saturday. For me, that's tough. But, you take out that burnout component.
You take out 40 hours you've already spent.
Yeah, I haven't already spent 40 plus hours with, documentation and all that stuff. I'm more than willing now to just, jump into the office for an hour.
Would you say you have more flexibility in the type of exercising and programming you can do with the
Yeah.
individual?
Yeah. And specifically with a lot of the clientele that I'm seeing, they're in more of a already pretty active. See a lot of CrossFitters, a lot of, recreational weightlifters, people that just generally like doing strength training, runners,
Mm-hmm.
things like that. So the way that my office is set up is it's in a CrossFit gym.
Mm-hmm.
So I have all the equipment that most of them are using. Big limitation for a lot of clinics is, they don't even have barbells, or they don't have a place to do pull-ups. And I know that was a big,
it took
yeah,
us over 2.5 years to get a barbell and squat rack in our clinic.
Yeah, and it's those conversations of, would you even use, who are you going to use this for? And it's everybody in all reality.
Yeah.
And once you get it, it's like the thing's never put down, and you're fighting with your 3 coworkers to try to, make sure you got your hands on it for part of your sessions.
Absolutely.
But yeah, so I have access to that. And then also, like, I can see people do the movements that are oftentimes what's causing their issues. Or I have the flexibility if it's somebody who's, when I get knee pain when I run, but it takes me to run 4 miles before I feel it. All right, run 4 miles and then come see me when you're done. Like, boom.
Yeah.
Now we can actually treat what's going on, find what's falling apart, and really kind of get to the source of that without having to utilize 3 to 4 visits of, let's try this, let's try this, let's try this. Okay, when you're home this weekend, run 4 miles and let's reconvene on Monday and see if what we did helped, type of thing. We can actually really get to the kind of source of that stuff a lot faster.
And that would cut down on the amount of visits someone would come see you for, which
Yeah.
you're saying with the cost, like you're doing this many visits, maybe insurance-based model with your copay, but then you see me this many visits because we can actually kind of treat what's going on and cut down some of those visits that were not going to say waste, but didn't really yield too much.
It's a lot more trial and error.
Yeah,
you would say.
Yeah. And so when you start balancing them out, really, again, it looks high cost per visit wise sometimes, not always, but it's not generally total treatment cost, oftentimes slightly less than if you were to go through the basic insurance model. Now that's not some people have phenomenal insurance. People that are, federal employees, former military, working with the VA or with, some of the TRICARE. Some of them, they have phenomenal coverage once they get into places. That sometimes they're challenged, but so it's not a guarantee that it's going to necessarily be cheaper, but that's kind of where you get into, finding a clinician that's really going to give you the outcomes that you're looking for too. So
yeah,
that's another topic we can get into here.
Yeah. So I know that, most people that see you, they still have probably insurance. They probably still have either like Blue Cross or Cigna or whatever. Do you find that some people don't really even know too much about their insurance, and you're having to kind of educate them on like what's been your experience with like people coming to you, they have insurance and they're probably asking you a bunch of questions?
Yeah, they're probably saying like, why shouldn't I go with insurance? Isn't it going to be cheaper?
That's probably the first question you get is, hey, do you take my insurance?
99% of the time is I've seen what you do with other people. Do you take insurance?
So how does that conversation go?
It's getting easier. I'll say that. Tough at first.
Probably learning curve.
Yeah. And you can sympathize with people. We pay a lot. I still do. Between my wife, we just had a baby, so we just added, another person to our insurance. You pay a lot every month.
Congratulations.
Directly out of your paycheck. Thank you.
You
but
named
you're paying
him Cam, right?
You're paying a lot every month for it, and it's one of those things like, I should use this. I'm paying for it.
Sure.
But when you really go back and look at your benefits, and a lot of people don't dive into this too much for kind of, I say minor things in a loose term. If you're injured, it's not minor. It's really affecting your life. But we're thinking not having, catastrophic surgeries or, life-changing medical procedures. Most people don't realize how much of that they're still going to pay for out of their own pocket before their insurance even really kicks in and starts paying for it. So there's two things that really I encourage people to look at when they ask me that is I'll ask them, what is your deductible and what have you met of that this year?
Yeah.
I get one of two answers. I either get really big eyes, like what language are you speaking?
What's the D word?
Yeah, that tells me that they have no idea, really the ins and outs of their insurance policy. Or they give me a really stone cold answer. And usually those are the people that have pretty darn good insurance. Like I have a $500 deductible. I had to get, something done, a scan. I've met that already. It's January. I'm good. The rest of the year is going to be great. Those people, it's a different conversation with them, but most people it's, I have a $3,000 to $5,000 deductible. That means that you're not going to get coverage from your insurance until you have paid that first. So now we go into the same conversation as we just had of total cost,
right?
Going through the insurance model versus the out of network model. Total cost may not much different, if maybe even a little less. Seeing myself, you're going to pay that anyways. That comes into the idea we talked about earlier, where they can submit those claims to their insurance on their own and have that be counted towards their deductible.
Yeah, sure.
But that's what most people don't realize is they're still paying that out-of-pocket cost, even though it's processed through their insurance until they meet their deductible, and then they'll get the 20%.
With a lot of educating, right? That you have to go through and walk the individual. It's like some of them have like the in-network deductible, and there's like the outer-network deductible, and
there's a lot of things, and I think you mentioned it earlier. Yeah, you mentioned earlier they're just trying not to pay for it. That's really what it comes down to. Is their bottom line is to not pay for claims. It goes up. They get bonuses and whatever it is from that. So that's usually the conversation that I have is what's your deductible look like? Do you know what that is? And do you know how much of it you've met? And especially when it's pretty high, which a lot of people now they're trying to keep their monthly premium lower. So they're going with a high deductible plan, being able to use an HSA and, drop their taxable income and all that stuff.
Sorry to stop you. Can people use a healthcare savings account with you?
Yes. Yeah. Okay. HSAs and FSAs. We're licensed healthcare providers. So we still have the NPI number. We can give them the appropriate documentation if they need to. Some of those accounts really are strict on submitting your receipts and things. That is what most of my clientele does is they have a high deductible plan. They max out their HSA every year as a tax benefit, and then they use that as they need to. So it's not really money, quote unquote, out of their pocket. But it is in the long run. But that's what a lot of people will do.
Well, that's good to know, because I feel like some people might not think that and can use that type of resource, which is very helpful. If you are wanting to seek treatment and your insurance is being wishy-washy on you or not getting you in time and all that kind of stuff, you can use your healthcare savings account and all that.
Yeah, and I felt like sometimes, too, people want more of that personal touch, and they don't want to feel like they're just a cat going through the line when they go to the doctor. I guess, who would you... What would you say to somebody if maybe they're on the fence of maybe going cash-based versus inpatient?
That's a really good question, and that's something that I'm learning still. As kind of the salesy side of being. They don't teach us that stuff in school. We are
nope
taught anatomy and physiology, and
hey, listen, even if you go to business school, you don't always learn this stuff.
And it's not to say that, you're not trying to treat people like, a business expense or, that's not the idea of the sales side of it, but it's education for people. So a lot of, what I try to encourage people is, asking them specifically, what's an outcome they want? What's something they can't do that they want to be able to do? What, that could be, I can't pick my kids up, or, I drive for work and after 20 minutes in the car, my leg's on fire type of thing.
Yeah.
Or it could be something that, I want to deadlift 400 pounds again. And right now I'm terrified because my back hurts, something along those lines. But having the conversation of what is positive a positive outcome look like to you? And that's really what we're trying to accomplish, is not, I want to see you for 16 visits because your insurance company approves it, or your doctor
Yeah.
sent a prescription that said 2 times a week for 8 weeks types of thing. I want to see you until we can create this resiliency in your body or your mind. Sometimes it's a kind of a mental block of you're able to do the things that you want to do, and ideally even a little bit better. You hear a lot of, I want to get back to where I was before. But I try to encourage people, where you were before you got hurt. So what if we kind of brought you up a little bit to a higher notch and kind of prevent that from happening again? And that kind of comes into, that kind of comes back into, I can see people for non-injury things, more of a performance kind of approach to it. Whereas, the insurance company would say, you fill out the questionnaire and the only thing you can't do is run a mile. You're good. Yeah. Discharge, 1 visit with a home exercise program and sayonara.
Right.
Whereas that, and I still treat people that same way. They're still discharged with home exercises. They're just a lot more specific. And then a lot of the people I see pretty routinely, because I'm in the gym with them too. And so it's kind of that consistent communication of, does this look right? Hey, can you just double check this really quick type of thing?
Yeah.
Or just, pure access of questions. My back feels great now. My shoulder's been bothering me.
Yeah.
Those types of things, you can kind of jump on them before they become too serious, where you're then limiting things again. So that's kind of the big, what I would consider salesy pitch. But the other component to it is just, direct one-on-one care. I'm the only one that's seeing these people. So it's always the same person. You get familiar. Communication lines are open. And then the other thing I really encourage people, and it's not always me, and I try to be pretty honest about that. If it's something that I'm not necessarily a guru at, but find somebody that does what you want to get back to doing. So for me specifically, I see a lot of CrossFitters. CrossFit's one of my main methods of exercise. But find somebody that does what you're trying to do. If it's yoga, Matt's not a yogi, very inflexible. But having the person that kind of does what you do, can talk the same language, understands the movements that you're trying to accomplish or the activities that you're trying to get into, and really can kind of empathize with what you're doing, and just has the knowledge of that movement pattern. That is invaluable in terms of being comfortable cutting down the trial and error type of thing that you talked about, and saying, like, I know this is what you should be feeling, but this is what you're feeling. Let's correct that. And that, for me, it's a lot of CrossFitters, runners, golfers.
Yeah,
that's kind of my forte. That could be, it doesn't always have to be a movement issue. I know you guys had Rachel on last week, or last episode. Not sure when you guys are airing this one, but that specialty for pelvic health. Yeah. That specialty for pelvic health, don't just go to a general clinician just because it's in network with your insurance. Seek out a specialist, somebody that this is what they treat, this is what they do on a day-to-day basis. They have such a deep understanding of that. And that's what I really kind of push to people. We hear a lot of this failed PT. They went through kind of cookie cutter basic stuff. Everybody does.
I gotta stop you there. We have a really good friend. He's super active. He tweaked his, I want to say injured, but he tweaked his back doing it was like a deadlift ladder in CrossFit. And so I tried to give him, he called me up, I gave him some advice, and I told him, I was like, hey, this doesn't get better in a week and a half, that 10 days where you you can kind of see if you're going to start to make a recovery, if it's going to hang around for a little bit. I was like, find a cash-based physical therapist in your area. And he goes, got it, man. Didn't listen to me. He was like, well, it's my insurance covers me going to PT. He went through 14 visits. He didn't get better. He showed me his exercise programs. I was flabbergasted on what this clinician had given him with kind of extensions and open books and all these like very general exercises. And I'm like, no wonder you didn't get better. And he goes, man, I went 14 visits. I had like a $35 copay. And he goes, I could have gone to see the cash-based therapist for like 6 visits and it would have been cheaper. And I was like, that's what I told you to do.
And then their fans, they're seeing, like you said, 3-4 people per hour or not more. And you can't spend that much time with someone when you're seeing all these people.
And there are good physical therapists that are insurance-based models. I just told him you need to
100%.
You need to make sure you want to have a little bit of knowledge going in to try and find them. I know like some people will, not to like toot my horn, people will seek me out because they know that I have gone through the residency and do more, functional things with people. But yeah, if you just go, you don't know who you're going to get, but you kind of know what you're going to get if you go cash-based, because they have this proven, system where they are seeing these type of injuries on a daily basis and not just general strengthening.
And it's more of a tailored approach, like he was saying.
Tailored approach.
Yeah, and you brought up a good point. I mean, there are phenomenal clinicians that are still working in hospital systems, more traditional settings, and there are some not so great clinicians that are charging an arm and a leg for working in a cash-based setting. They're just really good at talking to people and gaining trust. Just because you're paying for things in cash doesn't mean you're necessarily going to see the most skilled clinician. But in general, a lot of us have started in that kind of traditional model, found the flaws, realized we can't do what we want to do, and we are pretty skilled.
Yeah.
And so we've kind of branched out on our own, and it's kind of, it's healthcare in general, but I think PT is one of the bigger kind of trends. Is abandoning the insurance model is the only way we can take back kind of our independence with what we want to do. And it has nothing to do with, we are necessarily better or worse. It's just the ability that we had at the time to kind of make that jump. And generally, once people feel and see the difference, they're on board and they understand, okay, this is worth it.
Yeah, you're not being limited by the insurance at the end of the day.
Exactly.
You don't have you don't have a sign saying go 35 miles an hour. You know what I mean? Like, let's floor that bad boy.
Yeah.
We're in Kansas.
We're taking the governor off.
Yeah, and again, it's sometimes you're going to get great care out of some of those other clinicians, and if you have great insurance, I have a few recommendations I always keep in the back pocket for people that are like, dude, I have such good insurance. My deductibles met. They're covering this at 100%. Money's tight. We're in a recession. We get it.
Yeah.
Where can I go? And those are great questions to ask. It's not always that I'm the best person for them to see, but I know I want them to have a good experience. So I try to keep a few in my back pocket of, here's somebody you can go see that will take the insurance side of it that I know is still going to give you really good care. And sometimes that's, just as valuable to them as it is to see somebody that is in a cash-based setting. So
how can somebody find a cash-based PT? Is there like a website out there? Do you have to just go on Instagram, Google? How does that work?
A lot of it, it's tough. There's not like a good, I tried to look this up. There's not like a database. You can just go in and type, your zip code and give you a bunch of people that are doing this. Generally, what I found, and I kind of did a little search in the Chattanooga area, you just type in physical therapist, and most of the time, if it's like a person's name or one location, or kind of read the reviews, you can kind of seek out who's, cash-based, out of network, whatever it is, or who at least is seeing people one-on-one. There's also a website that I kind of utilize for friends and things that I have that are not in the area. There's a continuing ed company called ICE Physio.
Okay.
Institute of Clinical Excellence is what ICE stands for. A lot of the people that are going through their coursework are in the out-of-network side of it. So they have a website, ICE Physio. You can search clinicians that have taken their courses, and that gives a bio of the clinician, of, you know, what they work in, what setting they work in.
We'll put that in the show notes.
Yeah, we'll put that in the show
Yeah,
notes.
yeah, I can shoot you the link for that. But that's a good way too, of even if you're going to see somebody who's in, it doesn't matter what setting they're in, they're taking courses that are kind of promoting more of the general health, the exercise side of things. You're not going to get just the cookie cutter and then not a lot of modalities, which is, you know, another hot take we can save for another episode. But they're good clinicians that are taking those courses because they want to be better and they want to kind of see those people that are seeking out that specific type of treatment. So that's another really good one that you can find good clinicians on. And there's, I know in Chattanooga, there's 4 or 5 of us that are on that website alone. But you search all over the country and they're everywhere. So that's a big one that I will recommend for people that I know that are in different areas.
Yeah, that's good. So you work in a CrossFit gym. So
I do.
Give me a little background. How'd you get into CrossFit? And I know that we'll probably talk a little bit. There's maybe some misconceptions about CrossFit and stuff. I want to talk about that as well. So
CrossFit journey for me, I will say 2012, 2013, I had the same stigma. It's bad.
You're going to hurt yourself.
You watched your CrossFit games, didn't you?
Yeah. Then I started seeing some of my friends start it, kind of seeing people, that are a little bit more athletic, we'll say, coordinated, do some of these things. You're like, okay, it doesn't look so bad. Actually, it kind of looks pretty cool.
Yeah.
Fast forward to 2014, started PT school and was just working out at the school gym. Started to get some interest in my now wife, so I can say this pretty comfortably. She was, there's always external motivation. She was working out with us, I think just because she wanted to hang out with me too. But she would work out with us at the school gym, but I knew she was doing CrossFit. And so went to the same gym she was at, tried it.
You told her, looked her dead in the eyes, I love CrossFit.
Yeah. I was hooked pretty quick. It was not easy. I'm still not that good at it, but it's, one of those things where you really find kind of a good motivating community behind it. And that's really what kind of made me stick with it. Is it's challenging, kind of keeps you in that motivated state when you're coming out of a competitive life. Anybody that's played sports, done anything like that.
You played hockey,
but
right?
more than
what sports did you play back in the day?
I participated in football. Wasn't very good, but I was on the team.
Hey, that's what I say about baseball. I participated. I was on the team.
And then hockey and baseball were my two big sports, and then I played hockey in college. So that was, once you stop, it's like, what do you do?
Where's that drive?
That edge, man.
Yeah, you lose it. So that's what I really liked about CrossFit. Mostly, it's just that competitiveness, that the friendships I made from that. I mean, I still have a lot of those friends now. And it's really the methodology and the outcomes of it are, if you're consistent and treat your body well, are pretty hard to beat. It's one of the, generally most well-rounded treatment or training approaches. Is there some wild, crazy stuff out there? 100%.
Sure.
100%. There's a lot of things that not everybody should be doing. But one of the things that it's a quote I heard. I don't remember exactly where it's from, so I'm not going to give credit for it, but it's not my quote. I'll say that.
Okay.
But there's a quote that said, CrossFit is for anybody, but it's not for everybody. So meaning, it can be modified, scaled, adjusted. You can do all of the same general workouts to your athletic ability with maintaining the same stimulus that the goal of the workout is to achieve, whether that's cardiovascular, anaerobic, more aerobic approach, whatever the total goal of the workout is, you can still achieve that without having to do kipping pull-ups, overhead squats and snatches and all these Olympic barbell movements that people like to make YouTube videos of fails with. So
It's like you see what they're doing at the games, and what Matt Frazier used to do is, and you've
yeah.
never done CrossFit before, I wouldn't start there.
Yeah, and there's definitely there's two sides of it. There is CrossFit Games, and there is CrossFit as a
Explain that for us.
fitness modality, we'll call it. So there's now, I mean, shoot, they're professional athletes. They are sponsored. They don't work. They are training full time. I shouldn't say they don't work. A lot of them don't. They're training full time. They have a very strict regimented program that they're following. Mm-hmm. No different than somebody who's in the NFL and or any other professional sport. Yeah. They have their in-season training programs, and their competition is just exercising really fast for time. But that is a much different side of it than just going into your local CrossFit gym and saying, I just want to be healthier. I want to be able to deadlift 250 pounds and run a mile in the same day and be able to wake up tomorrow and pick my kids up still. That type of thing, which is much more functional for people than to say, I need to max out my 1 rep of an overhead squat because they did it at the CrossFit Games last weekend. Yeah. It's really cool to see. That is where you kind of have to draw a line of, what's your ability, first off, what's your background, and then, longevity. You don't need to do all that stuff to be in a CrossFit gym, to have the experience and to have the benefit of CrossFit as well, which I think is kind of a big misconception a lot of people have.
So if it's for anybody but not for everybody, who maybe wouldn't be for CrossFit? If you had to maybe you don't have to say, I don't know, but
yeah, no, and I thought about this. I mean, in reality, if you're somebody who is just, you're against that training approach, you are, I want to work slow and methodical. I don't want to have any, high repetition things. I don't feel like that mentality is what's best. There's a lot of exercise approaches that are going to get you pretty good results as long as you're consistent with it.
Yeah.
But other than that, really, it's more, I mean, it can be for anybody, and it's more of a mindset or a mentality. Well, I think are a little put off by it. And it's actually the world we live in. Again, failed videos, and we always highlight the bad stuff,
Oh, yeah.
Or if you see somebody that's got a really good physique or really strong, it's, they're on something.
They did put the work
extra
in.
Protein or Cheerios, if you know what I mean. And that's, that's kind of the hard part. But even, I've been in gyms that have teenagers. I've been in gyms that have 70-year-olds doing, modifying the movements, but still, picking things up that are mimicking activities of daily life and being a little bit heavier than what they do on a daily basis, so that they are preparing their bodies for whatever it can run into, and they're not going to get hurt. And that's really the biggest kind of approach to it. And it's also, they're getting cardiovascular endurance, they're getting strength training, they're getting a really good group-based community that's motivating and encouraging. And that's kind of what keeps them generally coming longer, being more consistent. And no matter what you do, as long as you're consistent in maintaining it, that's really, what you're going to see those long-term health benefits and, the quote unquote longevity from.
Yeah. So I guess you would say for some of our listeners, if they want to get into CrossFit, maybe scale it back a little bit of caveats there of maybe not do the full movement yet. Maybe, especially with the Olympic lifts, probably you would say, don't start those right from the bat. Maybe do something else instead of that.
Yeah. And it's just like in anything, you want to have an understanding of your own body first and kind of get an idea of what are you comfortable doing. You've got to have some prerequisites for a lot of those movements.
Sure.
And that is where I think for me especially, but I think for a lot of people, CrossFit kind of got a bad rap is, you have these people that are coaching that are decent athletes themselves, took a weekend course, got certified, and now they are technically qualified to coach
Tell my mom how to
CrossFit. And
lift, right?
yeah, and you see just a massive variety in quality with that. And again, the society we live in, everybody finds the bad ones, and or they promote the bad ones, I guess I should say. And that's the kind of negative stigma, I think, really pushed it is people that are just saying, well, this is what the workout is. You wanted to do CrossFit, pick this thing up, put it over your head, put it back down, keep doing it over and over and over and over and over again. And to be able to go through the movements, gym is so important for people if they want to get into it. A couple of notes I just put down for things that they can look for. They don't just throw you into the middle of a normal class. Find a gym that gives you kind of a foundations class or something that kind of ramps you up. And a lot of that would be body weight movements first, mastering air squat, mastering a push-up, doing things with a PVC pipe, finding awareness and control of your own body before you start adding external loading or apparatus, whatever it is. Finding one that has coaches that are not just taking the weekend course and calling it good. Ask them about, what kind of training have your coaches done? What have they done to continue their training? Are they doing, continuing education year, just the gym support them? A lot of interesting with them, but there's a lot of PTs that are in a cash-based setting that either own or work in the CrossFit gym that they're also practicing out of. So they are coaching, they are, being able to be hands-on with some of just the general gym clientele. Yeah. You can find one of those. I mean, gold. But you don't need a PT for that. There's very, very competent coaches out there. But just kind of do your homework and don't be afraid to just bounce around and try 4, 5, 6 different gyms in the area. Find one that fits your needs in terms of, the class schedules, the clientele that are there. If it's your first time doing it and you're in your 40s and you're just trying to stay healthy, don't find the gym next to the college that's got 20-year-olds that are still vying for CrossFit.
Right.
There's going to be a gym down the road that's got somebody that's just there to get their fitness in and they're just trying to stay healthy. You don't need to be at the most competitive gym if that's not what your focus or your mentality is. If that makes sense.
Yeah, and I guess to summarize for those listeners, if you're looking for a gym, when you're searching in the area, try to find a coach that's going to walk you through the progressions eventually. They're not going to throw you into the deep end, have you do these challenging circuits where you're doing a lot of Olympic lifts, because that's where a lot of the bad reputation came for CrossFit. They're going to properly teach you how to move your body, how to eventually move up to that point in time. And then also I think something that he was saying is find a good community that fits you and where you are and the stage of life that you're at.
And there's wide variety. There's typically multiple CrossFit gyms either in a city or a given
there's
area.
There's multiple.
So
the first one may not work for you.
In Chattanooga alone, there's I think a dozen of them.
Yeah.
See, there we go.
There's a lot of them. Maybe what's a misconception? I know you've talked about it some already, but maybe what's the misconception or injury rate?
That's a big one.
I don't know if that's something you know off the top of your head, but
yeah. So it's something I hear a lot of, especially in the setting that I work into. Is maybe I should just quit. I'm probably less likely to get hurt if I do something else. There's some things that are coming out research-wise. One particular study that I just looked at, more so just, Instagram and Google listened to us, and I was talking out loud about it, and this all of a sudden popped up into my suggested things, But it was a study that came out 2019, and I can send you guys the article for people if you want to
Sure.
link it in
Yeah.
the notes. But it just kind of highlighted the injury rates of CrossFit versus a couple of other training protocols. So it looked at powerlifting, it looked at Olympic lifting, it looked at regular strength training or weightlifting as a general exercise, not weightlifting in terms of a sport. And then it looked at running, straight running on the street, nothing fancy. Per 1,000 hours of exercise for each of those different components, CrossFit had 3.2 injuries per 1,000 hours. Regular strength training, so not the Olympic lifting, powerlifting stuff, just regular strength training, has 2.6 injuries per 1,000 hours. So not a huge discrepancy there. The one that really made me kind of look twice at it was just flat out running on the street, nothing else. 7.7 injuries per 1,000 hours. So if you really kind of break it down, it's more dangerous to just go for a run than it is to do CrossFit. It's kind of a very loose way of describing that study, but that's kind of what those are showing.
And also even with all three of those, even though running was twice as likely, those are still really, really low. That's 7 injuries per 1,000 participation hours. So it's still very low to exercise in general. And this is just kind of showing CrossFit also has a lower injury rate than maybe is perceived
than a lot of people think. And the hard part with CrossFit is, as I did kind of highlight, and these are things that I think need to be exposed and talked about, but the most common areas injured are shoulders, number one, and then lower back, number two. So when you kind of think about it, those are pretty important or sensitive areas.
Yeah.
That if you're injuring those, that kind of puts a little bit more of a damper on it. But another, I can't take credit for this, but another great quote that actually came from one of the ice physio course. It was one of the courses I took with them. He says, we're not losing people. People aren't dying because of rotator cuff tears and shoulder impingement. But when you think about like diabetes, cardiovascular disease, all the metabolic diseases you guys covered in, one of your very early on episodes, like that's what CrossFit is helping eliminate.
Yeah.
I can treat somebody's shoulder all day long. We can make their shoulders feel better. We can allow them to do these movements. Back pain. Yeah, it sucks. It's touchy. But having back pain versus having a disease that, you may not wake up from at any point in time, heart attack, stroke, all of these things are crazy on the rise. What if we ignored the musculoskeletal pain,
which is low,
things that can be treated, which, we already know is low, and really kind of looked or highlighted, we can get people away from unnecessary medications, unnecessary healthcare costs outside of, just the musculoskeletal issues, and really kind of give people their lives back. I think you kind of look at it that way. I said 3.2 injuries for your shoulder for every 1,000 hours.
Oh yeah.
Personally, if me, I can manage that.
Yeah, and that's the saying is that a lot of people, not even with CrossFit or any kind of lifting or exercising, you're like, well, I don't want to get hurt.
Mm-hmm.
But what's the risk of you not exercising?
Way higher.
Way higher.
Yeah. Heart disease is the number one thing to kill you.
Yeah, and even, I've seen people, tear their rotator cuff reaching in the back seat of their car to grab their bag. Like, there's no guarantee that, doing something else is you're never going to have these things. Granted, the percentage is probably a little bit lower, but
you can't go wrong getting strong.
That's another great quote.
No trademark here. I found that online.
Yeah. Oh goodness.
Well, Matt, thanks for sharing your knowledge with us about all the cash-based and insurance model, and even about CrossFit, because we're not promoting anything in specific. We're promoting people to reclaim their health and get self-reliant in their fitness. And if CrossFit is how you reclaim your health and become self-reliant, we're all for that.
Yeah, we want to get people moving.
We don't discriminate here.
Yeah, absolutely.
But how, if you feel comfortable, how can people find you? Yes, let's start with that.
Yeah. So my specific office is in Chattanooga, out of the gym called CrossFit Brigade. But the kind of starting point of Evo. So I think Cam mentioned earlier that I partnered with them. The kind of starting point of Evo is actually in Nashville. So there we have 3 phenomenal clinicians in Nashville, and then 1 in Smithville, Tennessee, which is kind of in Murfreesboro-ish area. That if you're in those areas, some of the info I'm about to give you is still you're able to access them from that. But specifically for reaching out to us, getting in contact or scheduling with us, easiest way would either be to go to our website. It is evoperformancetherapy.com. Or you can call/text 615-266-5599. And that goes to our central office manager, who kind of will schedule you whatever location is easiest for you. Biggest kind of perk, I would say, would be to follow us on Instagram at evo.pt. We give a lot of just tips, tricks, self-mobilization, self-management. It is geared a little bit more towards kind of CrossFit and weightlifting, just because that's the majority of the clientele we see, but still a lot of good stuff on there just for the general population of trying to keep yourself active and mobile.
Yeah, we can put that in the show notes for people
to find you. Do you mind if
you.
we also put your Instagram username in the show notes?
Yeah. Yep, absolutely.
Cool. Well, Matt, thank you so much for giving us some of your time on this beautiful Memorial Day after you've sweated through a Murph.
Yeah.
And we just really appreciate the knowledge you brought today, and hopefully some of our listeners can start applying what they learned today.
Yeah, and hopefully this is the first of many interviews that we do with you.
Yeah.
Yeah, no, I really appreciate you guys having me on. I love kind of the mission behind what you guys are doing, and yeah, hopefully we can collaborate again in the near future.
Heck yeah. Well, guys, just remember, as we always say, that you are human. We shouldn't seek perfection, but daily improvements. So,
all right. Thank you, guys.
See you guys.